When doctors prescribe drugs, we expect to get them in a timely manner, maybe that day or possibly the next day, and it's supposed to be a similar process for medical devices.
But for many who rely on this equipment, it is taking much longer, especially for people who live outside of the Valley metro area. So Arizona's family is investigating.
And as Amy Cutler found, those device delays could continue to get worse.
The insurance companies that operate under Medicare and Medicaid here in Arizona have lost many of their in-network providers for medical devices. Many of them have closed. Others find it's not profitable with the reimbursements that have been set. It's leading to months-long wait times for some to get the critical equipment they need.
They are extremely necessary.
This is cell phone video of Joe Moore getting into bed. This everyday task most of us take for granted is a challenge for the 75-year-old paraplegic.
How I get into bed should be with my Hoyer lift and not a slide board, because the slide board doesn't always slide.
Joe says his doctor prescribed a fully automatic lift back in March. It would help him get in and out of bed himself. But that's not what he says Preferred Home Care, a medical device provider, delivered.
It causes a lot of pressure on me.
His wife Mary left struggling to help him. Joe got hurt loading hay for his horses a decade ago at their home in Maricopa. They moved to Casa Grande soon after, hoping it would be easier for him to get around.
We've even had 2 doctors at once sending in the prescriptions for the same thing, and they still didn't provide it.
What has this waiting been like for you?
It's frustrating, especially when they decide they want to send the equipment that they want me to have out here. And I'm on the phone telling them don't send it.
Medicaid, or the Arizona Healthcare Cost Containment System, as it's known here, tells me Preferred Home Care billed them $24 in November for that wrong lift. To make matters worse, Joe tells me the company also delivered the wrong mattress. Access confirms they denied the claim, but months later, the wrong mattress is gathering dust at Joe's home. Joe is also still waiting on a chair that would make it a lot easier for him to use the bathroom. These medical devices are what's referred to as durable medical equipment, or DME. Doctors prescribe them, and they're supposed to be delivered in a matter of days. That has not been the case for Joe or at least 5 other disabled people in Pinal County we've heard from. Industry insiders tell me the insurance companies operating under Medicare and Access in our state have lost most of their DME providers. Preferred Home Care, which Lindy owns, is one of the largest DME providers in the country and one of the few left. They declined our request for an interview, writing in response that due to adherence to protected health information, we do not comment. We appreciate your understanding. Bob Warda saw the need in this community, so he and a business partner opened Sonoran Medical Supplies last year. Have you applied to be in network with these insurance companies?
Every one of them, and they're all closed to any new entrants. They say that their data shows that the area is adequately served.
Warda tells Arizona's Family Investigates that his company is the only one in the state with the mattress Joe needed. Joe says he had to wait months until his provider authorized Sonoran Medical Supplies to deliver it in July. Warda says months later, they're still waiting to get paid. When these patients come to you and they tell you about these months-long delays, what do you tell them?
Well, I feel the need to apologize because I feel horrible that I have a piece of equipment sitting right here and I can't give it to them.
I also reached out to the Centers for Medicare and Medicaid Services, a federal agency. They write patients may be limited in their in-network provider choices for DME because the provider must be in network for both the Medicare Advantage and Medicaid plans.
So it was a hard struggle, not just on my body, but the frustration that I was dealing with the insurance companies for not delivering what I needed.
Warda tells me he hears from people experiencing delays in getting their medical devices on almost a daily basis. He's reached out to state and federal lawmakers. Meantime, Senator Kyrsten Sinema's office tells Arizona's Family Investigates they know it's a problem and encourage families in need to contact their office. You can find a link on azfamily.com. Amy Cutler, Arizona's Family Investigates.